So let's start here. We have with us our guest. Good evening to one and all present here. I am Vaibhav Nagargoje, member of EDP Slide. On behalf of my whole EDP family, I welcome you all in today's session. It is absolutely correctly said that to win in the marketplace, you must first win in the workplace. So today's session, let's start introducing our workplace, that is Slight Longwall. Sant Longwall Institute of Engineering and Technology is centrally funded technical institute established by Government of India. Its lush green beauty is mesmerizing, established with a vision to act as an international podium for the development and transfer of technical competency in academics and industries as well. We EDP Slide are born with a vision to create leaders who can make a difference in the world, stimulating creativity and solving real world problems to give helping hands to the society is main aim of EDP. We EDP Slide is a team of young energetic technocrats that are growing day by day. We believe that ambition is the first step to success. The second step is action. Today, task of introducing our guest of honor and young dynamic inspirational speaker entrepreneur is great privilege to me. I myself know very well that this one is difficult, but she is a woman of virtue, simplicity, and dreams. I feel elated to introduce her to everyone today. After all, she is a living inspiration to the youth of nation. She is none other than Dr. Radhika Batra. She is a doctor, social entrepreneur, recognized by Forbes Asia 30 in 2019, ambassador at One Young World, Trust Conference, Change Maker, recognized by Forbes Asia 30 in 2019, ambassador at One Young World, Trust Conference, Change Maker, recognized by Forbes Asia 30 in 2019, ambassador at and founder. Am I audible?
Yes, sir.
Welcome, ma'am.
Hi, thank you so much for that lovely introduction. I think you praised me far more than I deserve. Thank you so much. And I'm very glad to be here to speak to all the young, inspirational minds. I think you guys are an inspiration to me because, things have changed so much from when I was in college, and everybody is just so focused and so driven, and that's not there, that wasn't there when we were in college. So, if Pawan or someone could just take me through how we're going to proceed with this session, I'll, formulate my thoughts that way. You just tell me how we should go about it.
Okay, ma'am. At starting 15 to 20 minutes, it's been said that you will be giving certain description about all your startups and all that, and then there will be certain standard question and answers from EDP that will last for 10 to 15 minutes, and then we will open up our session for our audience as well.
All right. So thank you for that. And, so let me talk about why. So basically, I'm not from engineering. I am not from finance. I am not from anything remotely related to the entrepreneurial world. I am basically a doctor. And how I got into the entrepreneurial world and and why I wanted to become a social entrepreneur is actually a very interesting story. So I'll start with that, and then hopefully, if as I'm talking, I'm just hoping that you people also in studying in college, and you might relate to what I'm going to say, and maybe find your own passion and find your own drive to do something about what you feel passionate about, truly passionate about. So when I was in college, I was an MD student. MD is Masters in Medicine. I was doing my MD in pediatrics, and while I was doing it, a lot of children used to die, and a lot used to become irreversibly blind or disabled for reasons that we could have prevented had the child either be brought to the hospital on time, or if the child was referred to a hospital with a ventilator, or if certain x amount of facilities were available on the premises, the child need not have died, or if we would have immunized the child for certain diseases. Basically, what I'm trying to say is that because of preventable causes, a lot of death and devastation was happening in the world and in the country. So that is something which affected me on a personal level, and I felt that we should do something to stop these deaths and to stop these children from dying or becoming irreversibly blind or disabled, specifically for reasons that we can easily prevent by timely, cost-effective interventions. And that's when I realized that we need to do something rather than I need to do something, because it's something I feel very strongly about. And until and unless I do something on those lines, however small the change might be, personally, I'll not feel good. I'll still feel that heart-wrenching sorrow when I see a person die of a vaccine preventable illness, a child die. So that's why I got into the social entrepreneurial sector, and I established Every Infant Matters back in 2017. And now, of course, it's going to be 3.5 to 4 years of its inception. And successfully till date, we have treated 54,000 children with vitamin A and prevented them from going blind because of vitamin A deficiency. So just a bit of, I'll speak about Every Infant Matters in detail. I have a few slides which I've made, and I'll show you what the organization is doing. But coming back to my personal journey, so we started off with Every Infant Matters on a very small scale, in one hospital, in one center, with just me and 2 of my colleagues to help me. And that's how we started. And today we are in 4 countries and across. अच्छा, हिंदी में ठीक है सॉरी, आई डिडंट रियलाइज दैट, आई एम सो सॉरी. मैं आपसे ये कहना चाहती हूँ कि अगर आप किसी चीज के बारे में फील करते हैं बहुत स्ट्रांगली, जैसे मुझे दिल से बहुत दुख होता था कि ये जो बच्चे हैं ये सर्वाइव नहीं कर पाते ऐसी इलनेसेस से, ऐसी बीमारियों से जिनसे हम और आप बचे हुए हैं, क्योंकि हमारे पेरेंट्स को ये विश्वास था कि टीकाकरण कराएंगे, वैक्सीनेशन कराएंगे तो हमारे बच्चे बच जाएंगे. ये जो बच्चे हैं, इनके माँ बाप पढ़े लिखे नहीं होते, उनके पास रिसोर्सेज नहीं होते, ठीक है, पैसों की बहुत इनको कमी होती है. तो इस वजह से नॉन एजुकेशन, अनअवेयरनेस की वजह से बच्चे बहुत ज्यादा मरते हैं. इस चीज को हम चेंज करना चाह रहे थे. तो एवरी इन्फेंट मैटर्स में बेसिकली हमने ये मुद्दे से शुरू किया कि हम चाहते हैं कि जहां तक हो सके कोई भी बच्चा किसी प्रिवेंटेबल कारण से ना मरे या उसकी जिंदगी किसी इरिवर्सिबल डिसेबिलिटी में ना चली जाए. स्पेसिफिकली अगर हम उस चीज को उससे बचा सकते हैं, चाहे वो किस भी रीजन से हो, कोई फैसिलिटी हो, कोई टीका हो, कोई दवाई हो, कोई वेंटिलेटर हो, बस ये हमारा मुद्दा था. और इसी चीज के लिए मैंने एवरी इन्फेंट मैटर्स शुरू किया था 3.5 साल पहले. यही मैं कहना चाह रही थी. So, as you know, you're not from a medical background, I think you might not be knowing this कि vitamin A की कमी की वजह से बॉडी में ब्लाइंडनेस होने के चांसेस रहते हैं, स्पेसिफिकली बिकॉज ऑफ विटामिन ए. नाउ विटामिन ए इज समथिंग व्हिच यू एंड आई गेट फ्रॉम आवर डाइट्स, द हेल्दी फूड वी ईट, द काइंड ऑफ milk we consume, the eggs we consume, all of this gives us the vitamin A. And the children who are in Asia, in Africa, in very poverty-stricken countries, they don't get vitamin A from their diet. And because of that, they start developing signs of vitamin A deficiency, and then they irreversibly become blind. So this is what is the main problem that we are tackling at Every Infant Matters. And it's a very big problem because 1 million hungry children become blind every year. So we picked this cause because of its sheer magnitude, the sheer numbers, and the travesty of the whole thing, that just by giving 2 drops of vitamin A, which all privileged children are getting from their diet, and these children are not getting because of lack of food, we can prevent a lifetime of blindness and misery. Because blindness, is a disability. अगर अंधापन आ जाए तो बिल्कुल आप ऐसे समझ सकते हैं कि जिंदगी खत्म है. वो भी ये थोड़े टाइम के बाद आती है कि शुरू में विजन ठीक होता है एंड देन उसके बाद ग्रेजुअली डिटेरियोरेट करता है. तो इट्स अ वेरी सीरियस एंड वेरी डेबिलिटेटिंग प्रॉब्लम. So hunger and disease have a cause-effect relationship. 250 million children in the world suffer from this vitamin A deficiency and are at risk for irreversible blindness. And out of them, 1 million actually actually become blind, like I had told you, but 250 million children are at risk for it. So if we can give the vitamin A drops to these children, we can successfully prevent blindness in these children. And that is what is our flagship project at Every Infant Matters. Now, as I said, the deficiency occurs because the daily diet is very bad. It's small amounts of rice. There's no milk, butter, eggs, and cheese. There's a loss of nutrients because of worm infestations. पेट में कीड़े हो जाते हैं बच्चों के. Specifically India में और abroad तो बहुत ही ये चीज common है. 880 million children in the world have this कीड़े की problem. तो इसमें जो हम second चीज करते हैं, first of course is vitamin A. The second thing that we do is basically about worm infestation. We give deworming tablets to malnourished children, and 20 million children in the world have a low birth weight than normal, which causes a lot of serious problems like infections and आगे जाके metabolic problems. Basically health burden country का बढ़ता है अगर एक बच्चा जो है वो समय से पहले हो जाए जिसका वजन adequate वजन से कम हो. तो newborn का adequate weight is 2.5 kg, and a lot of because of the conditions in the country are such that the mothers don't get adequate rest, they don't get a proper diet, and that is why the baby is born with a lower than average birth weight. And that is the third problem we are tackling by giving mothers prenatal vitamins from in their pregnancy so that their nutrition levels are maintained and the baby is born of a healthy birth weight. So like I said, hunger, we're tackling hunger. Hunger is SDG 3, and hunger is not just about feeling hungry, it's about preventing the horrible complications of hunger and malnutrition, which are of course stunting, recurrent infections, rickets and anemia, poor school performance, irreversible blindness, etc. So this is how Every Infant Matters works. Now coming to the entrepreneurial aspect of the whole thing. So basically we leverage the power of partnerships, and we have a high impact, replicable and scalable model. So our primary partnership is with this US-based organization called Vitamin Angels, which gives free medications in 70 countries. And we have implementing partners in 4 countries. After India, the second strongest partnership is in Nigeria. Then we have a implementing partner in Kenya. We have one in Dominican Republic, and we are working on establishing our projects in Rwanda and even Yemen now. That is not included in the presentation. Now in India, we have partners all over the country in the most remote and inaccessible areas. And how we do this is we leverage the religious groups, we leverage the local hospitals, doctors, health setups, the local NGOs, local specialists, Gurudwara charitable clinics, and so on. So all of these are our implementing partners, and they are implementing our projects to create basically a high impact and last mile delivery system of our medications. So this is how partnerships have helped Every Infant Matters. Basically, we have got free medications worth $, this big amount. And we have utilized and established last miles in 4 countries. We have been able to minimize costs and deliver a very high impact. These are some of our biggest partners. We have partners in the UK, in the US, a lot of partners who are supporting us in one way or the other. So I feel like, the lesson learned here is that we're all in this together. We're all trying to make the world a better place. So help each other. Now, how we're working is, suppose there is an NGO working in the slums of, say, Northeast India, not the slums, sorry, the interiors of Northeast India, in Manipur and Mizoram. Wahan to bilkul there are hills and tribals. There's no infrastructure as such. वहाँ पे एक NGO काम कर रहा है, उनके volunteers हैं, लेकिन उनके पास equipment नहीं है, उनके पास दवाइयाँ नहीं है, तो हम अपनी side से ये सब उनको भेजते हैं. So the lesson here is that a lot can be done if you have synergistic partnerships. So keep that in mind, and that is how we have been able to succeed, and that is how we have been able to. Hi, am I audible?
Ma'am, actually I want to know the name of that NGO that is working in Manipur, because I am the student of the JNV Komong for 1 year.
So we are working with CDI. CDI is Center of Development Initiatives. Basically, they have headquarters in Assam, and we work very closely with CDI. So we have done a lot of COVID relief with CDI. We have done a lot of vitamin A and albendazole distribution. I can show you the pictures later on. You can contact me on LinkedIn. Okay? Then we can talk about Manipur if you're interested. ठीक है. So मणिपुर में तो we have done quite a lot of work.
No, ma'am, actually I am the student of that place, that's why.
So you are a student of that place. अरे वाह, तो आप हमारी फिर वहाँ help
Okay,
करा
ma'am,
देना.
thank you.
ठीक है, ठीक है, ठीक है. That is great. All right. So let me get back to this. So
That ma'am only for 1 year, not for all.
it doesn't matter. Whatever you can do will be useful. All right. So let me just
Let
talk
ma'am
about
complete PPT. Yeah.
Okay, I think he got happy that we're working in his area.
Yeah. Actually, it will be.
Yeah, so we are working on projects that promote nutrition, like giving vitamin A to prevent blindness, deworming. We have a holistic health program where we promote breastfeeding. We dispel harmful myths related to childhood care. Now, as you know, India is basically a hub of रॉन्ग प्रैक्टिसेस. ठीक है, कोई किसी का बच्चा बीमार होता है, उनको साधु बाबा के पास, रिलीजियस गुरुज के पास ले जाते हैं, वहां झाड़ फूक कराते हैं, डॉक्टर के पास नहीं लेकर आते. तो ये सब चीजें बच्चे के लिए बहुत हार्मफुल होती हैं, क्योंकि ये जो क्वैक्स हैं, जो ये बाबा जी लोग होते हैं, ये कुछ तो दे गिव सम हर्ब्स और दे गिव सम इंडिजिनियस मेडिसिन व्हिच आर वेरी हार्मफुल फॉर चिल्ड्रन. उसमें स्टेरॉइड होता है, उसमें कभी कभी पता नहीं क्या खराब चीजें होती हैं, जिससे बच्चों की तबीयत और भी ज्यादा खराब हो जाती है. फिर बच्चों की आंखों में काजल लगाते हैं मोटा मोटा, उससे इन्फेक्शंस के चांस रहते हैं. फिर क्या करते हैं कि जो काउ डंग होता है वो बच्चे के अम्बिलिकल स्टंप पे लगाते हैं, वो शुभ माना जाता है शुद्धि के लिए. उससे इनफैक्ट की सेप्सिस और इन्फेक्शन और डेथ के भी चांसेस होते हैं काउ डंग सेप्सिस से. तो ये सब चीजें हम खत्म कराना चाह रहे हैं सोसाइटी में. अफ्रीका की साइड में क्या है कि वहाँ फीमेल सर्कमसिजन का बहुत और फीमेल जेनिटल म्यूटिलेशन का बहुत ज्यादा वहाँ प्रॉब्लम है. So we are trying to tackle the local problems of the local areas by giving parents a holistic health education, trying to counsel them about what is right and what is wrong, counseling them about nutrition at low cost. See, in our country and in Africa, people cannot afford good nutritious food, but you can, advise them to buy things like bananas. Bananas are low in cost, but very high in nutrition. Then eggs sometimes. Some eggs are also okayly priced and they are very highly nutritious. So we have to counsel them about how to get maximum nutrition out of a low cost, right? And of course, we have other projects going on like promoting gender equality, HIV, tuberculosis, blindness, stigma, disability. And then, of course, since March of 2020, we have been largely focused on COVID relief. Of course, now we have reduced the COVID relief activities as the need in the country has decreased. So we work in slums. This is how the operational model works, that we have well-established last mile delivery channels in slums, villages, orphanages, construction sites. We conduct camps and medical outreaches by the Indian Medical Association, local doctors, NGOs. We serve homeless children in the slums, and we distribute through charitable clinics, NGOs. Basically, जिस भी जगह लोग हैं जो अच्छा काम करना चाहते हैं, हम उनकी सहायता से, उनकी हेल्प से अपना अच्छा काम लोगों तक पहुंचाते हैं. बेसिकली एवरी इन्फेंट मैटर्स का यही मोडस ऑपरेंडा है, यही पार्टनरशिप्स पे ही हम लोग काम चलाते हैं. एंड आई थिंक जहां जिसकी मदद हो पाए without thinking about personal factors and about ego factors, or about just about why should I share my products with them. No, that's not the way the world works. If you want to make a difference and you want to make a change in the world, you have to all come together and help each other in whatever way you can. So see, I am passionate about health. There could be someone who's passionate about education, but जहाँ पे जैसे मेरे चैनल्स है नाइजीरिया में, ठीक है, उन बच्चों के लिए मैं हेल्थ प्रोग्राम्स कर रही हूँ. कोई अगर आप में से एजुकेशन के प्रोग्राम्स करना चाहता है तो यू कैन कम टुगेदर विद मी, कोलैबोरेट विद मी. सो दिस इज द वे यू कैन लेवरेज द पावर ऑफ पार्टनरशिप्स टू गिव अ स्केलेबल हाई इम्पैक्ट मॉडल. And that is how we work with Every Infant Matters, and we try to help those, as many people as possible. Whoever reaches out to us, we try to help them. So this is a aspect of last mile delivery. This is our team in Nigeria, and वहाँ पे एक कैलाबार रिवर करके है जो कि एक आइलैंड को कनेक्ट करती है. आइलैंड में जो है बहुत कनेक्टिविटी रोड्स की नहीं है, बहुत डेंजरस रिवर है एक हाई करंट वाली. तो उस पे दवाइयां बोट्स पे लेकर हमारी टीम जाती है ताकि वो जो आइलैंड के लोग हैं वहां तक दवाइयां पहुंच सके. तो दिस इज समथिंग कॉल्ड लास्ट माइल डिलीवरी ऑफ सर्विसेज और लास्ट माइल कनेक्टिविटी और गोइंग द लास्ट माइल. So this basically means कि जो लोग geography से या किसी और चीज से, जैसे माउंटेन से या सोशो कल्चरल बैरियर से किसी रीजन से आइसोलेटेड है, हम उन तक भी पहुंचना चाहते हैं। मान जैसे एक उत्तर प्रदेश में एक ट्राइब है मूसाहार ट्राइब करके, जो कि बिल्कुल मतलब अपने में रहते हैं, दे डोंट लाइक टू इंटरैक्ट विद आउटसाइडर्स and they don't want to take the help of any person who's not from that tribe, and they are in such a poverty stricken condition that they actually have to eat rats sometimes. That's why it's musahar. कभी-कभी वो उनको rats खाने पड़ते हैं। तो ऐसे लोगों तक हम अपनी सेवाएं और सहायता पहुंचाना चाहते हैं, और इसीलिए we try to do our best for the people who are isolated. कहीं जैसे हिमालयाज में चले जाएं तो काफी जगह होती है जहाँ इनएक्सेसिबल होता है रास्ता रोड से, तो ऐसी जगह भी हम नहीं चाहते कि कोई ऐसे बिना सहायता के रहे। तो ये हमारे हेल्थ कैंप्स हैं, ये दिल्ली में अभी जनवरी में हुए थे, जिसमें हमने साथ में साइमल्टेनियसली 225 स्लम्स इन दिल्ली में कैंप्स कराए थे, जिसमें 17,000 बच्चों को हमने हेल्थ चेकअप और प्राइमरी केयर और बेसिक मेडिसिन दिए थे, और 4,500 बच्चों को विटामिन ए और डी वर्मिंग दिया था। तो ये मेडिकल स्टूडेंट्स की सहायता से हमने किया था। So this has been our impact so far in 4 countries, that 54,000 children have been given vitamin E to prevent blindness, 43,000 children have been given deworming tablets, 29,500 pregnant women have been given prenatal vitamins, 59,000 disadvantaged families have been given holistic health education कि क्या आपके बच्चे के लिए अच्छा है, क्या नहीं है, कैसे अपने बच्चे की केयर करें ताकि उसकी जो जीवन है उसमें हेल्थ बनी रहे पूरी लाइफ। ठीक है, तो दूसरी एक चीज हम और करते हैं कि जो करंट हेल्थ सिस्टम है, जैसे अभी मैं आपको मणिपुर का बता रही थी, तो जो मणिपुर, मिजोरम, जो ये नॉर्थ ईस्ट के स्टेट्स हैं, इनमें काफी जगह जो नन्स हैं, कैथोलिक मिशनरीज हैं, दे आर डूइंग मदर एंड चाइल्ड केयर, कोविड केयर एटसेट्रा। बट प्रॉब्लम आती है कि दे आर अगेन आइसोलेटेड, दे आर नॉट very up to date with the latest in medical science, the latest in medical facilities. So what we do is we have a training session for these nuns and these who are either nurses or they are informal healthcare providers, and we train them in basic aspects of mother and child care, in resuscitation of newborn, in COVID. अभी जब COVID का बहुत ज्यादा चल रहा था, तो हमने, क्योंकि इन सब के लिए तो COVID बहुत न्यू है, और ये जो बाकी की दुनिया से इतने आइसोलेटेड है कि इनको कोई सिखाने वाला नहीं है, इनको कोई पढ़ाने वाला नहीं है कि कैसे अपने आप को कोविड से बचाएं और कैसे अपनी पेशेंट की कोविड में केयर करें। तो हमने एक सेशन इनका कोविड पे लिया था, जिसमें हमने सारे इनको सिखाया था बेसिक केयर, अपनी कैसे सुरक्षा करी जाए कोविड में, कैसे अगर माँ और बच्चा है उनकी कैसे केयर करी जाए कोविड में, सब हमने इनको बताया था। और हम वीकली बेसिस पे इनके लिए एक सेशन रखते हैं, जिसमें हमेशा 800 से 1300 नन्स जो है 9 कंट्री से ज्वाइन करती हैं, जो कि पूरे वर्ल्ड में हेल्थ केयर सर्विसेज दे रही हैं। लेकिन इनको जो भी मेडिकल साइंस की डाउट्स रहती है या ट्रेनिंग चाहिए होती है, वो हम लोग यहाँ डॉक्टर्स की टीम है, वो हम लोग इनको ऑनलाइन जूम मीटिंग्स या गूगल मीट पे इनको ट्रेन करते हैं। अच्छा, नाइजीरिया में व्हाट वी आर डूइंग इज कि ट्रेनिंग ऑफ 100,000 कम्युनिटी हेल्थ वर्कर्स हैज बीन गोइंग ऑन। वहां पे ऑफ कोर्स कोविड इतना नहीं है, तो फिजिकली वहां ट्रेनिंग सेशंस होते हैं। So for every infant matters, because as you can see, we've been here for 3 years, but I want to do a lot more. And I have a lot of ideas. I have a very strong vision. I want to develop a technology aspect. Now, this is where engineers like you can help me. And I want to develop an Android app, which helps me scale the project further, which helps me track. So vitamin A has to be given in 2 doses. The first dose is given, and then 6 months later, the second dose is given. So I need to build an app to track down the patients. I need to build an app to screen children who are high risk for serious illnesses. I need to do a lot of things with technology, and that's where I will require the help of tech experts like you, because I have no idea of technology whatsoever. And 3 years goals are, of course, replication in 3 more countries. Like I told you, we've been working on Rwanda and Yemen, and we're also in talks with Cameroon. So let's see. We want to build a financially sustainable model. Right now, our model is not financially sustainable. So our priority, like I said, is developing technology for educating the children and educating their parents, for screening, for patient retrieval, to track movements of our health workers, for accurate data storage, to maintain an inventory, for monitoring and evaluation activities, and so on. Right. So we have a couple of new projects going on. I think I'll just cut it short now. one last thing, our social return on investment, जिसको हम SROI कहते हैं, वो 1:72 है. मतलब कि for every US dollar invested in every infant matters, the return is worth $72. So अगर आप ये इसका मतलब जो ROI होता है, इसको हम social return on investment कहते हैं. And of course, this is what our aim is, that with your support, with the support of everybody, like I said, we work on a partnership, and with the help of our supporters, the fight will go on. Of course, COVID relief में हमने बहुत सारा काम किया था. हमने पूरी country में PPEs, Kenya, Nigeria में PPEs, food packets पहुंचवाए थे. उसको I'll just take you through the slides once. ठीक है, so this was we distributed chocolates to COVID warriors. Then food packets, ये बहुत जब लॉकडाउन चल रहा था तो माइग्रेंट वर्कर्स के लिए और होमलेस लोगों के लिए हमने ग्रोसरीज एक महीने की भिजवाई थी. उसमें 20 kg आटा, 20 kg चावल, 4 टाइप की दाल, स्पाइसेस, ऑयल, ये सब हमने किट पूरा भिजवाया था उनको. देन ये मूसाहा ट्राइबल्स का मैंने आपको बता दिया. फिर पुलिस और सिक्योरिटी गार्ड्स के लिए हमने फेस शील्ड, मास्क और हैंड सैनिटाइजर्स भिजवाए थे. ठीक है, फिर ये अफ्रीका में एक प्रोजेक्ट था जिसमें हमने सैनिटरी नैपकिन, एक्चुअली वहाँ के जो स्लम्स हैं वहाँ पे सेक्सुअल प्रेडेटर्स बहुत रहते हैं, एंड जो टीनेज गर्ल्स हैं 11 to 17 years की, दे डोंट हैव द मनी टू बाय सैनिटरी नैपकिन्स, सो दे हैव टू एंगेज विद दीज सेक्सुअल प्रेडेटर्स टू get money to buy essential items, which is absolutely horrible. And for them, we had sent a huge lot of sanitary napkins and other essential items. नॉर्थ ईस्ट के बारे में जो पूछ रहे थे, so this is in Manipur, Singat village quarantine center. So this is one of the villages we work in. I have a whole list of villages where we're working in Manipur, and I of course can't remember the names right now. I can send it to you, but Singat is one of them. And वहाँ पे जो quarantine centers थे पूरे मणिपुर में, वहाँ पे कोई health setup ज्यादा है नहीं, तो ये जो volunteers थे ये लोग ही कोविड के पेशेंट्स को हैंडल कर रहे थे. लेकिन इनके पास कोई पीपीई नहीं था, कोई मास्क नहीं थे, कुछ भी नहीं था, तो हमने इनको खूब ढेर सारे N95 मास्क, प्रोटेक्टिव इक्विपमेंट, फेस शील्ड सब भिजवाए थे. तो ये हमने काम और किया था. जो वहाँ की नर्सेज और नन्स हैं, हमने उनको कपड़ा भिजवाया था कि आप अपना, और उनको मास्क बनाने की टेक्निक समझाई थी, तो वो खुद अपने मास्क उन्होंने बनाए. फिर अनफॉर्चुनेटली उनको लोगों की सेवा करते करते उन लोगों को खुद ही कोविड हो गया था. बस फिर यही, this is the end of my slideshow. This is the end of what I have to say about Every Infant Matters. And now I'll just where is it? Yeah. So now I'll just let you guys ask me what you want to ask me, and if there's anything more you'd like me to talk about, then please tell me. If there's anything you want me to repeat in Hindi, then tell me that as well.
Ma'am, it was very good to know about your Every Infant Matters, and it dragged me around all the concepts that you shared with us. And actually, I am also very happy to work with you for this great work that you are doing.
Yeah, you must. So we are always looking for volunteers, for interns, and if anybody is interested, please I'm just dropping my email in the chat box. You can just send out an email to me, or you can just approach me on LinkedIn. Anything will do. Right? So, and if anybody wants to start work in their own areas, I'm sure there are a lot of people from diverse geographies here. So, किसी को भी अपने गांव में, एरिया में, कहीं पे भी कुछ काम शुरू करना है, तो मुझे बताएं, and we will get it set up there. And in fact, we're looking for implementing partners. So please, reach out. Well, thank you so much. Nikhil is saying absolutely amazing. Thank you.
Thank you, ma'am. And now we have some standard question from our team, that is EDP. And then we will open the session for our audience present here. So, ma'am, first of all, I want to know about the journey of Forbes Asia 2019.
So, I would say that, Forbes Asia, of course, is a very big validation to my work. And it feels very good that, I was recognized and everything. But to be very honest with you, it's just another thing. And I would advise everybody who's listening to, of course, keep these things as a motivation for you to work hard and succeed in life. But don't make it a priority, because it's, it's not, chasing these things is not going to get you anywhere. My journey, of course, was I was nominated. by I think so one of my seniors or something, and then I got an email saying that you've been nominated and you've been shortlisted in round one. So then there was a massive interview process, and after that interview around April of last year, I got an email saying that you have been selected and you're one of the 30 under 30 for the year 2019 for in under social entrepreneurs category. So that was the Forbes journey. And of course, ideally, agar pandemic nahi hua hota, to all the Forbes honorees for a year, we meet up at a summit in Hong Kong. But because of the pandemic, I was not able to go for that. It wasn't held, it was cancelled. So that was my journey with Forbes. And since then, we have, of course, I've engaged with the fellow co-honorees on the group. And ऐसे इवेंट्स में और ऐसी चीजों में क्या होता है ना, आपको पार्टनरशिप और नेटवर्किंग की बहुत अपॉर्चुनिटीज मिलती है. जैसे मैंने आपको बताया कि एक दूसरे की हेल्प करनी होती है, वो हेल्प आप तभी कर पाओगे अगर आपको पता होगा कि सामने वाला क्या कर रहा है. तो आप when you meet people from different geographies, from different countries, from different areas, they all have their different set of problems to talk about, and they all have a different sort of outlook to life. And once you discuss the problems of different areas, and then you come together, form a solution, and that's how you holistically make an impact on the world. So that's the beauty of these titles like Forbes, like One Young World, and things like that. So, Aniket, you have a question, kya? Just ask or drop it in the chat box, whatever you like.
We would take it after, ma'am.
I'm just getting notifications that people are raising their hands. So, whatever they like to ask, they can ask me. Yeah.
We will be surely taking their questions.
All right. What else?
And ma'am, next is like, it was great to know about the Forbes journey. And next is like, what let you open this Every Infant Matters?
That I already covered in the beginning, like there was a lot of death and disability all around. Mostly because if 10 children were to die, I would say that 7 would die of things we could have prevented very easily. So that is something, which didn't agree with me. And I'm sure, मतलब, किसी को कोई भी थोड़ा भी सेंसिटिव इंसान होगा, उसको सोच के देख के बुरा तो लगेगा कि ये जान हम बचा सकते थे, लेकिन इसके पेरेंट्स को ये आइडिया नहीं था टीका लगाने का, या इसके पेरेंट्स को पता नहीं था कि जैसे ही सांस में दिक्कत शुरू हुई उसको हॉस्पिटल लेकर आना था. तो ये सब चीजें हम खत्म करना चाहते हैं, and that is the vision behind Every Infant Matters, to prevent death and disability due to any preventable cause or any thing which can be sorted, or any problem which can be tackled with resources or equipment or vaccine or medicine, something, all of these things.
Yes, ma'am. Really, we जब हमें पता चलता है कि हम वो कुछ उन्हें इम्प्रूव कर सकते थे, लेकिन ड्यू टू लैक ऑफ प्रॉपर नॉलेज एंड ऑल दैट,
काफी बार ऐसा भी हो जाता है कि छोटी सी चीज, जैसे मैं आपको एक एग्जांपल देती हूँ. मेरे पास एक पेशेंट आया था, उसको सीजर्स आ रहे थे, पता चला कि उसको डॉग बाइट हुई थी, और उसके पेरेंट्स ने इंजेक्शन उसको कुछ नहीं लगवाया, जो रेबीज का टीका होता है वो नहीं लगवाया, लेकिन उसको एक बाबा जी के पास लेके गए जिन्होंने कुछ झाड़ फूक करी और बोला कि ये काफी है, टीका वीका कुछ जरूरत नहीं है. तो उसको रेबीज हो गया, एंड रेबीज का तो आपको पता ही है कोई इलाज नहीं है. तो 4 साल की एज में उसकी डेथ हो गई बच्चे की. बहुत इजीली बच सकती थी. डॉग बाइट हम सबको हुआ है अपनी अपनी लाइफ्स में, एंड ये एक बच्ची है, बट ऐसी एक नहीं, ऐसी हजारों हैं पूरे कंट्री में और अफ्रीका में, और जो अदर अंडर डेवलप्ड कंट्रीज है वहां पे. ये हमें चीजें बदलनी है दुनिया में, और इसी के लिए दिस इज द रीजन व्हाई वी आर वर्किंग टुवर्ड्स एवरी इन्फेंट मैटर्स, एंड वी आर वर्किंग टू मेक ubiquitous access to healthcare, which basically means कि हर इंसान को हेल्थ की सुविधाओं पे एक राइट है. ठीक है, मतलब ऐसा नहीं होना चाहिए कि अगर मैं अफोर्डिंग हूँ, मैं पैसे दे पा रही हूँ, तो मुझे कुछ सुविधाएं अवेलेबल हैं और वो किसी गरीब इंसान को नहीं अवेलेबल है. तो ये जो है, ये बहुत ही इट्स नॉट फेयर, इट्स इनजस्टिस, एंड दिस इज हेल्थ इनइक्वालिटी, एंड दैट इज व्हाट वी आर फाइटिंग, एंड दैट इज व्हाट वी आर ट्राइंग टू चेंज बेसिकली.
Yeah, thank you, ma'am, for giving your this valuable time for to cure this all the diseases, and letting the people really actually become aware about this thing. So next one is like, when we are in initial stages of any project or any startup, we need motivation. Like, who motivated you to for this good cause?
I think there were a a lot of motivating factors. The sheer number of deaths I used to see used to motivate me. Then, of course, my parents have really motivated me since childhood, because both my parents are doctors, and since childhood I have seen them work hard to treat their patients, to do something extra for their patients, to go the extra mile. And I think that has been my biggest motivation, both from my father and my mother. My father used to stop at accident sites to help patients get to the hospital. जब मैं छोटी थी तो मुझे काफी बार याद है कि हम लोग डिनर से वापस आ रहे हैं और रास्ते में रुक के मेरे फादर ने किसी रैंडम स्ट्रेंजर को अपनी गाड़ी में हॉस्पिटल तक छोड़ा हो. और एक बारी हम स्विमिंग पूल में थे तो एक जो इंसान थे he drowned, so my father gave him CPR and revived him right there on the swimming pool area. And my mother has been working for the poor since the last 15-20 years. She has been working she's been operating poor patients for free. She has been doing non-profit work, a lot of things she has been doing. So she's also been a great inspiration and great motivation for me. And I think these things have really helped me and motivated me in my journey.
Really, ma'am, in everyone's journey, if there is parent support, then it will be like an extraordinary journey for him or her.
Of course, parents think very differently from us. I think all of us listening will agree कि हमेशा ही होता है कि उनके थॉट्स हमारे थॉट से नहीं मैच करते. वो चाहते हैं कि हम एक चीज करें अपनी लाइफ के साथ और हम कुछ और ही करना चाहते हैं. ऑफ कोर्स मेरे साथ भी वैसा ही हुआ था, वैसा ही होता है आज के दिन में भी. कुछ चेंज नहीं हुआ है उसमें. लेकिन आपको मतलब एक पॉइंट ऑफ टाइम के बाद आपको ये सोचना है कि आपको क्या इम्पोर्टेंट है, एंड व्हाट you have to do something which gives you happiness from within, and you have to focus on that. And that is what I have been doing. And touch wood, my parents have been supportive about it. Of course, my father does get that thing in between कि पढ़ाई करो, आगे super specialization करो, ये करो, वो करो, ये तुम ज़्यादा टाइम इसमें लगाती हो charity work में. तो उनके अपने thoughts हैं. Or with all respect and with very respectfully, I listen to him. But at the end of the day, I know what I have to do. I know what I want to do, and I'll just end up doing that. So I mean, I think all of us can relate to this problem, that our parents have a very different vision for us than we have for ourselves.
Yeah, really, ma'am. And now I want to ask that, like, how you were able to reach out internationally at such a young age, this much, like Nigeria, and in your slides also Africa and all that thing.
Yeah. So again, like I said, this venture, I started off on a very small scale from one city in India with 3 people. Then I expanded it with the help of my friends and family to a few more places within India. Then I got selected as a One Young World ambassador. Now, One Young World is basically a community of youth-led under 30 people making a change in the world. So that is where I met like-minded individuals, and it's ultimately all about networking. You have to meet other people who are working in their areas with some problems. You have to come together, collaborate, and reach out and holistically serve humanity as one unit, not one against each other. That is how I was able to reach out internationally. I found people who had the same vision, who wanted to help the poor, but they did not have the resources, but they had the staff on the ground in, say, Nigeria or in Kenya. Now, I am in India, but I have the system built where I can help them with resources, with medication, with guidance, with training. So you all help one another. It's a synergistic relationship, and that's how we've been able to expand to foreign countries.
And now, like, ma'am, one more thing, like, to grow any organization, like how much it is important that teamwork to make any organization successful, according to you?
See, to make any organization successful, you have to be very passionate about what you're doing. If you don't feel very strongly about your mission or your cause, and it doesn't have to be non-profit, it can be a for-profit thing. कल को अगर आप में से कोई कुछ product ही market करना चाहता है, until and unless you really love that product, I was just saying that you have to really feel for your product, for your service, for your humanitarian work, whatever you're doing, you have to really, really, really feel for it from within. You have to be very passionate about it, because unless you have that fire within you, you're not going to be motivated on a daily basis to work towards your goal of making that venture or that company successful. Okay, don't run after money. Money is not something you should run after, because at the end of the day, it's you can make money by doing illegal activities also. You can make money by just doing anything, but if you're not truly passionate about what you do, and it will not make you happy, and after a certain point, even money doesn't make people happy. So that's what I have realized in my years of experience. Of course, I am not all that experienced. I'm only 29, so let's see what happens. Yeah.
And ma'am, how important is being motivated for entrepreneurial journey? Like
So like I said,
motivation
you
throughout
cannot
the.
be a successful entrepreneur or a successful, you cannot run a successful venture until and unless you treat that venture as your baby, as your brainchild. ठीक है? So it's like जैसे आप अपने बच्चे को या अपने lot of people have pets. I don't have a pet, but the people I know who have a pet, they're very, very nurturing, and they're very caring about their dogs or their cats. And if you don't treat your venture with that love and care and hard work and dedication, it's not going to hit off, and it's not going to be successful. So that is it. You have to just really be driven by the cause and by what you're doing. That's the thing.
Yeah, good to know it, ma'am. And like we also know that with your projects you help internationally. Like which country you felt need to be helped more? Like where you find I can make a better stand with them?
ये कंट्रीज तो बहुत हैं जिनमें बहुत नीड है. अब जैसे यमन का आप सबने पढ़ा ही होगा, क्या वहाँ स्थिति रहती है कॉन्फ्लिक्ट रिडन जोन्स में. क्या नॉर्दर्न नाइजीरिया है, वहाँ वो टेररिज्म ग्रुप का बहुत इन्फ्लुएंस है, वहाँ के बच्चों की हालत बहुत बुरी है. तो नाइजीरिया में तो वी हैव बीन वर्किंग सिंस द लास्ट 1.5 years. So Nigeria projects are quite well established, and there are so many countries and there's so much work. I mean, I just feel like I should be able to reach as many as possible. I don't think I can put one above the other, that one is more needy than the other. There are needy people everywhere. There are needy people in our own country. I mean, India se zyada poverty kahan hai? It's just the way you prioritize, and it's just the way you see that you can't put one against over the other like that.
Okay, ma'am. And like what is your message to young energetic entrepreneurs to improve the skills they are lagging behind? Like they should improve.
Of course, they should improve, and the best way to do it is to reach out and find mentors in those particular skills. For instance, if someone wants to reach out to me for anything, for just public speaking, or how to be more confident in meetings, or just small things, small things make a difference. And everybody, I've realized, in our generation is very eager to help youngsters and very eager to mentor people. So if you can find mentors to help you in one particular skill set which you think you're lagging behind, then there's nothing like it. Just requires a little bit of time and effort, and a little bit of it just requires a little bit of dedication from your side. I mean, at my level, in pediatrics, there are so many things which I don't understand. So I also look for mentors and teachers to help me, to teach me on. So I think it's always about the elder people teaching the younger people, or the more knowledgeable people teaching the less knowledgeable people. It's just the way the world will work. You have to pass on your knowledge and your skill sets, otherwise they just die with you. That's not the way it should be. Yeah. Someone's raising a hand. Hi, I can't hear anything.
To this mentors, but in our India, am I audible?
Yeah, now you're audible.
Yeah, ma'am. Actually, I was saying that in English countries, we can see there are many mentors to support their young kids. But in India, we couldn't find very easily a mentor. So what is the role of mentor in one's journey? Like,
Very strong role of mentors in one journey. And if you, if you really want to find mentors, it's not that difficult. You have to reach out to people who reach out to other people who reach out to other people. And finally, you'll find someone with the kind of skill set you need. For instance, I'm talking to you right now. Anybody who needs help in any aspect, please reach out to me, because I have friends, I have experienced professionals as friends. Of course, I even suggested to Pawan, one of my friends, who was keen to mentor students. And so just whatever anybody needs, please reach out to me, and I'll help you I'll find you someone to help you with whatever it is, if I can't help you myself.
thank you, ma'am. And one last question from my side. Like, where would you find like infant matters in upcoming years, and what more will you bring to our nation, or like in
I want to expand, of course, to several other countries. I want to expand to at least 3, 4 more countries. And I want to build a technology aspect. I want to work within India in the poorest of the poor areas. And I want to screen children for deadly diseases and take them to the hospital before the situation gets too bad. That is what is my aim for the next 1 year. And then let's discuss it at the beginning of 2022 and see how much I've got it done. But this is the vision for now.
Thank you, ma'am, for dragging our whole minds towards this every infant matters, and the situation currently Nigerian peoples and all our Indian, even Indian childs are also facing these issues. So thank you for thank you for making our mind toward this. And now I am done with my questions. I will open the question and answers for our audience present here. Any questions? Let me check a chat box.
People are raising hands. Just ask them to speak out. Someone is asking, how did you manage your studies and work? Raman Madhukar. So, Raman, of course, studies are very overwhelming, especially for a medical student. So, it was difficult in the beginning. And that time, of course, I was more focused on studies than working. So, you have to prioritize what you need at that time. Suppose you have exams coming, you have university papers. Please don't focus on ventures other than your exams. Having a degree in hand is very, very, very important in life. So, don't compromise on that. And after you've got that degree, then you have time. You have, of course, you'll be working, but you will not have that padhai ka pressure. So compartmentalize your life and prioritize what you need to prioritize at a certain point of time.
And ma'am, one more question I'm seeing here, like how you started this journey initially as individual when you were in college. Is it something from college?
As an individual, so first I connected with my donors. I made them understand how I want to help the society, and I had to convince them, because nobody gives any kind of donation without being truly convinced, right? So be it money, be it medication, be it anything, if I don't convince the person, the donors, that I am going to use it properly and utilize it in a fair way, then nobody's going to send me. So that is how I started as an individual. I had a lot of meetings with a lot of donors. I had to explain my vision. I had to reach out to a lot of people. And that's how I began my journey in one place, in one hospital. And today we are in 4 countries. So yeah, that's a good thing going on.
One more question is there, ma'am.
Why then, ma'am, entrepreneurs? No, ऐसा तो कुछ नहीं है. Who said we don't want to hire degree holders? I'm not hiring, but when I do hire, of course, so see, the world is a very harsh place, Rahul. You have to understand that a degree is a thappa of approval, nothing else. You could be the most brilliant person in the world, but if you don't have a degree, to your name, it's going to be difficult for you to rise. Of course, people do rise. It's not that नहीं होता उनका कुछ. कितना भी कोई इंटेलिजेंट हो ना, डिग्री होना तो थोड़ी लाइफ में स्टेबिलिटी रहती है. आप समझ रहे हो बात को? तो डिग्री होना बहुत जरूरी है. ठीक है, डिग्री के बिना बहुत मुश्किल होती है लाइफ. ठीक है, ऑफ कोर्स आप कुछ भी कर सकते हो. आप में दिमाग, when you are smart, you can literally do and succeed at anything. But if you have a degree, it just makes the process a lot more smoother and a lot more easier, because the world is such that it is, a sort of way for people to trust you. Right?
So, how can okay? Thanks a lot. Oh, you're welcome. How an introvert can successful in making networks. See, even though you're an introvert, you have to sort of talk a little bit about your work. Whenever you go for a conference or wherever you go for a meeting, you meet interesting people, you meet new people at a party, you just have to, the conversation goes in that way ki, acha, what are you doing? So you talk about your work, ki, this is the venture I'm starting, this is what I'm doing, this is how, and you just talk a little bit about your work. I would not say be overly friendly, be firm, polite, do a little, and see if how the conversation flows. If it flows in a direction that the other person seems interested, then then you take it further and you set up maybe a personal meeting where there are not so many people and you have a safe sort of space, a sort of safe environment. Maybe you take a friend along who is an extrovert and who understands your vision. So if you falter at any time, if you feel nervous at any time, a friend can help you out. Just the way yeah, it's going. Better hire someone extroverted. Yeah, you can hire someone extroverted also to do your talking for you. But then you always run the risk of that person taking the contacts for themselves. So all better to, develop a communication skill such that even if you're an introverted person, you can, have a little bit of professional communication, if not more. So I was listening to Elon Musk and he said that it is not necessary to go to college to do something. What's my view about it? It's definitely not necessary, but there is one Elon Musk and there is 1,000 unemployed people who don't have college degrees. So please keep that in mind. Of course, there are successful people who don't have college degrees. There are successful people who are from not very well-known colleges. Okay, if you consider me a successful person, I am not from a very well-known college. I did my MBBS and MD from a place in Ghaziabad. But I'm just saying that having a degree is much better than not having a degree. So, weigh it out like that, weigh out your options and think about it. Of course, if you don't want to do your degree, there's of course nobody who can force you, but life will be smoother. After 10 years, you don't want to regret कि मैंने अपनी degree छोड़ दी. तो किसी तरह अगर घुस गए हो तो खत्म करके निकलो. That is my only advice to you. That is it. आगे जाके दुनिया बहुत harsh है. कोई भी आपको अगर 10 रुपए की भी job देता है ना, बिल्कुल निचोड़ता है वो 10 रुपए के लिए. There is no easy job. There is no easy life after you finish college. So you have to make your life smooth as possible where you can. ठीक है, जॉब पे आपकी कोई कंट्रोल नहीं रहती. आपको तबीयत खराब में जॉब करना पड़ता है. आपको मेरे हाथ में खुद में कैनुला था और मैं और बच्चों के कैनुला लगा रही थी. There is no escape to hard work after you finish college. You have to work hard, and when you get paid now, they really put you through the grind and there is no escape. Achha, Elon Musk doesn't run the company alone. They need some good degree holders, I think. Of course, everybody needs, yeah. See, degree, why are you people focusing so much on degree? Degree क्या है? Degree education है. ठीक है, अगर मैं कल को जाके बोलती हूँ सबको कि मेरे को बिजनेस आता है, ठीक है, लेकिन मैं MBA नहीं हूँ, मैं MD हूँ, तो कौन मेरी बात मानेगा? आप समझ रहे हो बात को? दुनिया में कोई भी किसी को ट्रस्ट नहीं करता और ये जो डिग्री होती है बस ये एक प्रूफ होता है कि हाँ आपको ये काम आता है. तो अगर आपके पास वो प्रूफ हो तो आपकी लाइफ थोड़ी सी इजियर जाती है एज कम्पेयर टू कि आपके पास वो प्रूफ ना हो. ठीक है, अल्टीमेटली तो डिग्री होल्डर्स भी ऐसे होते हैं जिनको कुछ नहीं आता. मेडिकल प्रोफेशन में ऐसे बहुत लोग हैं जिनके पास डिग्रीज है लेकिन दे आर नॉट गुड डॉक्टर्स. बट दैट इज नॉट समथिंग व्हिच इज आइडियल. ठीक है, सो दिस इज व्हाट आई एम ट्राइंग टू एक्सप्लेन टू यू. All right. So, what is he saying? Introverts have other good options too. All right, Rahul. Sahi baat hai, ma'am. Elon Musk doesn't alone run the company. Okay, which way can we contribute to your organization? Many ways you can contribute to my organization. First step, look at the website, see what interests you, reach out to me. There's a lot of communication work to be done, social media, website, technology building, fundraising, lots and lots of work to be done. Please reach out to me on my email, and if you have some questions, you can ask me. Have a fundraiser in your university, please do that. You want to do something like एक आप fundraiser करना चाहते हो जिसमें आप कुछ भी वो event करके funds raise करो. Anything you can do, right? Best stage for starting a startup, any age. Last stage for having it successful, no age barriers at all. Do it when you feel it's right, when the time is right. And success, of course, comes anytime. There's no age limit for it. Oh wow, you started your startup in graphic. Please help us, yeah. Just check out our website, please. We need graphic designers. So, Ankit, I am vouching for you. Please help me with my website and other graphics. Thank you. What
We'll be
else,
taking one
guys? I
more,
have to leave.
Yeah,
Yeah,
ma'am.
soon.
That's
So
why
please,
that's what I am saying. We will
just
be taking one question, and we will be having here end.
right.
So, ma'am, thank you for your great presence with us. And here I would like to invite our Pawan sir. Pawan sir.
Yeah, I'm here. Am I audible to all of you?
Yes, sir. Yes, pretty good.
Yeah, okay. Yeah, first of all, I would like to thank all the EDP team to organize this event and to cooperate me basically for this special Forbes special series with Radhika ma'am and Piyush Verma, which is held tomorrow at 7 p.m. on the same platform. And the next one, a very special pleasure meet to you, ma'am, and a special thank to you from all of our EDP Slide family to joining with us, guiding all our students and motivating them. And as you said that you do a lot, you did a lot of work in this pandemic, helping needy people, or pandemic hit on poor people. So as we also took an initiative in this pandemic as a Corona Defense Army by our EDP family, and I would like to proudly say that we helped near about 318 families by financially.
That's
Yeah.
great.
Yeah. And we are always ahead to collaborate with NGOs or contributors or change maker like you to do some changes in the society. And we also some proposals and some plans to connect persons like you. Okay. And surely as we are connect personally with on our WhatsApp and LinkedIn, so surely we are looking forward to work with you and work with your organization. And sorry for that if you get some kind of things you get in touch with regarding that degree. Okay. So our students are getting mature day by day, so they will really mature when you are joining us, and they will really ask you about your every front matters and some of the startup
Definitely.
questions like that.
Yeah.
Okay.
Definitely. And anyone needing any kind of mentoring in any field can reach out, because I have friends everywhere. I can always connect you to someone. And there are always the people like me who are ready to help youngsters, who want to help youngsters. In fact, I'd introduced one of them to Pawan. So if you guys want the session with him, please tell Pawan as well. And जैसे भी आपकी मैं help कर सकती हूँ, please बताना. And hoping to speak to you guys soon again. Meanwhile, please follow Every Infant Matters on Instagram and follow me on LinkedIn, and email is there. Anything you want, please reach out. All right.
Okay. Thank you for your valuable time. Thank you so much.
Thank you. Very nice session. Thank you so much. I had fun. Bye.
Bye, ma'am.
Thank you, participants, for joining with us. Thank you.